Okay, and then the knife handles.
Oh, 1, 2.
And back. Oh wait, did I miss?
Okay.
Straight sponge. Oh, the forceps. I'm sorry. Straight sponge forceps. Those are like that.
1, 2.
Okay. And then back cock. Towel clip.
1, 2. Oh, I'm not on the tips. 1, 2, 3, 4.
So just a tip, like this, leaving them all clipped like this is not a good idea.
Oh,
okay. And the reason being is because if your surgeon asks you for a towel clip,
I need to.
you don't clip all these. So make sure that you always have your instruments accessible. That's kind of just a little tip.
Can I
for you
reply?
guys.
Or is that it?
That's it.
Okay. That's it.
I think Mr. Sanchez is the one that told us to have them all put together.
Yeah, he told us that. I'm like,
And then
Have
how
them
it
all
is to
put together.
yes. So,
But I think it's true.
but yes.
My rule of thumb as a tech is to always have everything visible so the circulator can see it and accessible.
And not
So
connected.
they need it, it's ready to go.
Yeah.
I'm not having to unclip anything or
Yes.
put things
Right.
together, it's ready to go. That's just my tip.
Okay, so we could do them, leave them like that, cause all right, the Liga Clips applier. 1, 2, 3. Okay. All right, now we're gonna start with my board over here.
with the,
Do I go
the
over
left
there,
and everything, right? Okay.
All right,
Can we
pass
come
right
this way
behind
again?
you.
No, I would just.
Right.
Right.
Even with these instruments here, like organization wise, that's like for you.
Okay.
So there's gonna be multiple variations on organization.
I
I
put
don't
that one
like things
there.
like that myself, you know, but a lot of techs do. And a lot of techs like these, they put them here on the actual tray. Yeah, I like them too,
Yeah.
but there's variations.
Oh, and like that, right? They can be facing up. They can be
Oh,
facing
yeah,
up.
they can start with.
Okay. Yeah.
Laps?
Oh, laps. Now, when she said laps, I start opening or before?
Right, you don't take the tab off until you're ready to count.
Okay. Laps. 1, 2, 3, 4, 5.
Okay.
1, 2, 3, 4, 5.
So when you're counting,
Matrix?
make sure also that you're counting with a distance so they clearly see.
Oh,
Sometimes
okay.
I have texts and I'll tell them when they're counting,
Yeah.
because they're counting like real low. And I don't know if you saw that real clear from over there, but they're like 1, 2, 3, 4,
Yeah.
5. A lot of texts do that. That's not the way it's supposed to be done. You make sure you have enough distance and separation so you really can show that it's 5. Okay?
Oh.
All right, so then 5 and 2 go here.
I'm sorry.
We want them over there. Okay, we're getting ownership already, aren't we?
Right. Okay. 1, 2, 3, 4, 5,
Yes.
6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Hit nurse.
Jump. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
Bogey tip.
One.
Singles.
1.
One.
Mm-hmm.
Doubles.
1, 2.
Eights.
No, 8.
Blades.
1, 2.
Okay. All right. So then we're done.
Mm-hmm.
That's it.
Well, you're not done.
Oh, no. Like that.
Now, Eileen, at this point, since you took her word for it that the suture was correct, I would come over here and verify just to be sure, because that's an area where if it's wrong, both of you get points off.
Okay.
Okay?
Oh, okay.
So y'all already counted it, but
Yeah.
you can come verify, just
Like-
kind of look at her packages and go, okay, she's did 2 doubles, yeah, that's correct, we're good. Yeah, you don't need to have a recounter, just a verification
now,
from your end.
Do I start like, putting everything here already?
That's correct. Get your
Okay.
blade loaded.
Oh, yeah, my blade.
Sometimes the nurses will hold on to it, or they'll put it at the board. You can leave it with your clipboard.
So I don't want to see the.
You're gonna need it because at the end of the case, you count. Remember,
Only
before you
one?
start closing, yeah,
Only one?
before you start closing, you load your knife handle. Load your knife. No, you count.
Oh,
No,
she
I
has
say
to-
you
okay.
start to,
Load, okay.
she was loading and I said you load your knife handle. No, you do end counts before you start closing the layers, the abdominal layers. So you would need that count sheet again, so you hold on to it.
Wait, did I put it backwards? Did I put it backwards?
Yeah, you did. So a good tip is look at the knife, handle and look at the blade. The numbers should be facing you. The number of the blade
Yeah.
and the number of the knife handle.
She has like a
And,
men's.
Okay.
I was like, keep calling him he until she came in here.
Okay,
Like,
Trying
people,
to put the
people
kidneys.
hear people.
No, at this point, would they put like a phone to the patient?
Yes.
And they do that in pre-op?
What's that?
They'll do that in pre-op?
Yes.
Okay.
No.
That's a coker.
I was trying to do this one.
Margarita. Cause you were busy, all of that time.
I was like, I never did that.
I just called it first.
What?
I was like, hold it.
Yeah. That goes to about midway.
Okay.
Yep. Take your kidneys with you.
Just like this, and then in the trunk, it's gonna take a
So
turn.
these pictures are short. This one.
Oh, okay.
And this one goes here.
Really? I thought it was here.
So,
Like
I
that.
thought they're just the kidneys.
The kidneys
Oh,
go here. Yes.
Let me go get the
30 minutes to
four
fold.
times.
20 minutes again.
Okay. Let me fix it.
We're probably gonna set a time, like, last time, you know how we're like, oh, everybody wants to come at 8 or whatever, 9, whatever.
Did
And
we
then
sign up for Friday?
we have it until tomorrow, we get to sign up for Friday.
That's it? You do it. Come in here. Okay, so it's like this. No, the other way. No. So what you do is,
No,
so you get from here,
we
and you
usually.
come
Oh,
here.
okay.
So we want to say,
Yeah, we're
Yeah.
gonna,
Here.
Yeah.
Okay.
sign up.
come and sign up. I will get here until.
Okay, so I get from here and then
That
flip.
and flip.
Okay, so I go
So what we cover here first?
And flip. There you go.
Okay.
Uh-huh.
Two,
4 cryols,
4 crowns, 2 peons.
2 Kellys.
Oh, I call them peons.
Yeah, it's fine, but if you remember the C tab, you're gonna remember Kelly. Mhm.
Okay, 2
They're like, calling
Olive, sorry, olive.
And they're gonna look like they're cooking. They're gonna see that you're trying to choke your patient. Oh, no, pobrecita, she's good.
Then you come down and lay it here.
I know.
Make sure these rants are over the, okay?
Okay, now,
Load your sponge stick.
She has abs though, she's good.
okay, it's 3, 1, this one goes first and this one goes here. And here. Okay?
So, but you see how it's unfolding on you?
Yeah.
So you want it to be like this. Alright. Margarita's a scrub.
Here.
You scrub.
I go, okay, it's the same way, but I just hold it, right?
And, yeah, don't touch. You're not sterile, remember. You're surgically clean. So you come in, now you already went like this. So you scrub and walk again. Okay. Got it. Okay. Now get your utility sheets. So you come in like this. So she's here already, so your surgeon's here. Go ahead and grab her a towel.
Oh, not that one?
No,
Second scrub tech, oh, Surgeon Carmen, come
Oh,
in.
okay.
This is your second scrub tech.
So then,
You're fine, you're fine, you're fine.
Sorry,
No.
sorry.
Oh,
Oh,
you're
so
you're
I'm
scrub, you're
I
surgical
am
clean,
scrub.
yeah, you
Okay.
scrub, well, you said you scrub,
But I thought the surgeon.
both of you scrub, no,
Okay.
both of you are gonna do this case.
Do I go to him or he comes to
She
you?
came in
Oh, sorry,
first, but now, I would suggest from here, you get your towel, and so, one thing I taught the other classes is that here, you get your towels already prepared, like,
Oh.
have them organized with your.
I thought this all was gonna be.
No, you never use these at the hospital, okay? So go ahead and get your towels like this on top of your gowns, and so when you come and get the towel for your surgeon and your scrub, you bring it from here, and I come this way. And then, okay, so
Okay.
give me your hand. Extend out
Remember
your palms
money,
up,
you want money.
like that, and like that, you do, now you do it, so come on this quarter, watch your back, no, no, so you're gonna get your back, turn the other way, there you go, and Carmen? Uh-huh, now who's Carmen's your surgeon, so you have to introduce yourself,
Hi, my name is Johanna and I'm gonna be surgical scrub student here.
okay? Get the gown ready.
Dr. Ramirez.
For who?
For Carmen.
Carmen?
Dr. Ramirez.
So Dr. Ramirez, is,
Dr. Ramirez.
if she's ready, whoever drops the towel first, it doesn't matter,
And
Drop it.
over there.
just drop it. Okay, she's here first,
That
so
was
go ahead.
Carmen's.
Okay, well now you got Carmen's, so,
It's small.
okay, so open it.
I'm the circulator, how do I get over there?
You can go through there or go through the back, just make sure you clear them.
Yeah, bring it up. You're welcome.
Now, you have to watch your back,
Yeah.
again,
So
okay,
I
so
just-
you're over here, you're still not paying attention, so you don't know what your distance is, so again, I wanna recommend that you make sure you step away, and your back's this way, where nothing is in your way back there, okay?
So I
Put the
just
gown,
go with.
and put the gown on Margarita. Okay, so then
I can't see it.
because you need to grab it from here, from the farthest end corners, okay, and make sure you don't cut into her sleeve opening.
Okay.
So you're doing this, you don't have to do all that, like that. And she's gonna come in and let go, there you go, okay, now get your surgeon's gloves on.
6.
Can you put the arms a little bit back?
So like, Carmen, don't go all the way down,
Okay.
okay, so just kind of keep it at this level.
Okay. Yeah, like that.
Now I go 7.5, right?
Now, remember that if my second scrub tech would have come in and she would have gown and gloved my second scrub tech, and I still have things to do over here, second scrub tech when you gown and glove the surgeon. Yeah, cause you're sterile at that time.
I'm gonna grab your string. Oh wait, no, I don't grab the string, right?
Is that it?
Yeah.
Oh, I thought that was the other one.
Cause the thumb faces me.
You're right, some places hurt, so, not like directly, like, just like that. And then it's two, like this, now either you're gonna have a towel or you're gonna have a net.
And at that point, I think Margaret, she can help her because she
Yeah,
has.
she can help her because she has a glove hand, yeah. Okay, and try not to go too far down also, okay? Get your stickies ready.
Sticky.
Stickies so that you can turn her, Carmen, while she's getting her sticky sheets ready to go, and you can turn her, Margarita. Don't let that, let it drop, you gotta turn her.
Okay.
I do it over here.
It fell down.
Up here.
Okay.
So then, give her the tag, give your circulator the tag, give her the tag, give her the tag, she'll tell you from behind. Drop grab a hold of it. And she'll have to tell you from behind. Remember. Okay. Once we do that,
Tear.
so this one,
Oh, yeah, because I was gonna face me.
if you were gonna do it yourself, but you're not, you're
Oh,
gonna hand
yeah.
it to somebody else.
It's supposed to be like 3 facing away,
Yeah.
or you 1 facing away?
If you're gonna assist with the draping, if you're not, you're
Okay,
gonna be
because I
handing
have
it.
the second.
Scrub tech. Okay, so now you're gonna get to the opposite side. So you're sterile, she's sterile, and there's not a whole lot of room here.
So then,
Tell Jahaira if you please step back
Back?
or to the side, you know, get out of the way for her, please. Okay, so watch, I want you to do that because of what you're doing. What you're doing.
she's facing the back.
Right, so you gotta face the field. You gotta face the field. So get close to your table because you're sterile. So when you're walking, and now turn this way. There you go. Okay, all right.
Now I'm gonna give the surgeon first, right?
That's correct. So make sure that adhesive though is up.
Like that?
Mhm.
And I get it.
Yep. Yep. Closest to you. And I'll give one to Margarita.
This is when everything is straight, right?
Yeah.
Time roll.
but does it matter how we put
So
it?
you have to be careful.
Like,
Yes, it does.
no, the sides, how we put it. Do we start from that side, this side, that side last, or?
So it should be closest to you, and then the dirtiest, which is symphysis pubis coverage, nipple line, and then away from you. So this
Okay.
one here, you
Should
can't
have been-
cross over if you're doing it yourself. But since you're doing it, then you put it here.
Closest to you?
Yeah, closest to you.
And then how do, I already forgot how to pronounce this. Like this.
No.
Get your big drape sheet ready.
Oh, yeah.
Dear surgeon.
Okay, like how that stayed up, can I fix it or?
No,
can I-
Carmen, you can't.
No, I mean, just leave it there,
And then
and
because
when
it's
you
gonna
put that,
come.
it'll secure it.
Okay.
So watch, you don't need to do that, you can give it to your surgeon, so that you're not too close, and she can do it.
I can go back, right?
Yep. You get ready to pull your mayo. But wait until they drape the patient out. Pull it towards you, girls.
So I can see.
Find your corner. Okay, so it's the other way.
Give me the money.
Yep, let them go.
Give me the money.
Okay. Okay, yep,
Yeah,
you got
like
it.
that. On top.
Ready? Take a step,
1, 2.
and from this level, when you drop it,
Remember not to let it, your hand go down.
and drop. And short, okay. Now do the same thing over here. Find your corners. It's right here. Yep. Ready? 1, 2, 3. Go. Anesthesia grabs it. You come over here, Margarita. Put your finger here. Put your hand here to the fenestration and pull this down with the other hand.
With the surgeon first.
Unfold it all the way to the foot. You wanna make sure you cover this, cause you see this?
Yeah.
Check. That's unacceptable. That's gonna
Yeah,
be
because
extended.
then that will touch my table, okay.
So extend it all the way. There's another fold. Now you have another fold. Unfold it all. And it's okay to like come further down to do this from here, from the toes. You don't have to like do this, right?
Can I bring my keyboard?
Okay.
Alright. Time out.
Hold on to it, not yet.
I get
Time out went right before you pass the knife handle.
Time in. Sorry.
Mhm. Bring your back table. Circulator, where are you?
I'm right here.
You can help her. She needs help. You can help her. Like from the bottom, from the legs. Not come get this.
Okay, so now I get
Duck walk it.
there, right?
This is where your time ends. So it's at 29.
329?
We did better.
Okay.
Can
so
I
now,
put it down?
now, yeah, sure.
I think just go ahead and, that's good?
That's good. Now get your towel. Now during test time, what's gonna happen here is that the surgeon will walk away and I'm just gonna see Jahida set up. But since we're practicing, go ahead and work together to set up the field. In the real world, you're gonna work with your surgeon and your second scrub tech to set it up. But when we're testing, I wanna make sure you know how to do it by yourself if you had to. I'd like to put the towel open end here to secure the holster.
Oh, she said, because Miss Ramirez said the other way.
Yeah.
Oh, she likes it the other way?
Yeah, that's why you're there.
Yeah.
Are you gonna stop us for that?
No,
If one
no,
of
no,
us
but I'll
says
tell you
wait.
why. I'll always give you a reason why I like to do that, okay?
Now I
And that's because this holster, double is just thicker. Sometimes it's a little bit harder when the towels are thicker to get into the loop. A single is not so hard. So it's just a little easier than the double towel. That's why I single it myself instead of using the double,
Okay.
okay? Across.
Just let it drop right over there.
So you see what you're doing, curling it? So all you have to do is when you're at this point, extend out and just bring it back.
Oh, okay.
And this, just drop it. Okay?
Oh.
And then this, secure it right there.
Oh, there's a little security.
I did. 25 years of doing this, I think I can teach y'all a few of my tricks, guys. All right, so take off that little,
Not a few, all of them.
Can I?
not all my
Can I put it
tricks.
in?
Yeah, you can put it.
Sorry.
Same thing, you're gonna do, extend, then come back and discard the rest.
Come back.
Uh-huh, and discard the rest. Yeah, just drop it. Right there, just drop it. Just like that. Now also bring it. There are some hooks right here, you can put it through there. Now, don't drop it.
Oh.
Yeah, you see how you dropped it? Now that would be contaminated. So you gotta hold on to it and then put it through there.
Okay, sorry.
And that's if you wanna use it. I don't like to use those hooks. Because if they need me to, move the suction or something, I have to undo it from there. I don't like to do it. So I just always use my mag pad. That's what I would use to secure it. Some techs do like to use it. Some, like Mr. Sanchez, was like thing showing you how to clamp it with a clamp. Was it this team that was it? No, the other team said it. And Mr. Sanchez was showing you all how to secure it with a clamp. Some techs do it like that too. You know, again, there's different ideas.
Yeah. Go.
Okay, open it up. That's it. Done. And so when we test out, right, what I'm gonna do, again, you would have stepped away, you guys would have stepped away, you would have set this up. And so I'll ask you, like, are you complete? And you're gonna say, you're gonna look, yep, I'm complete.
If you know that I'm not complete, can I say something for? If I know that I'm not complete.
Yeah, if you know, before I ask, because I'm gonna ask you, are you complete? And you're gonna say yes or no, right? If you're not, because you look around, you're like, oh shoot, I missed this, I forgot to load these late. You'll go ahead and load it at that time.
I'd be like, okay, yeah, now I'm done.
Right, so once you've done that, then I say, okay, so then I'll come in and I'll inspect and make sure you have the proper tools on the roll, on here, that the blade is loaded. I look for organization, make sure that your tools aren't like this, okay? I look for neatness, so there's like indicators thrown everywhere, I'll take points out for that, so make sure that your indicators are all out of the way, everything's nicely organized. I come to your field, I look to see, I'm gonna get your Bovie, this is what I'm gonna do. I'm gonna check it, I'm gonna make sure it's secure, that's good to go. I'm gonna do this here, yep, is it secure, either through there or with a mag pad, good to go. And then now I know that.
Oh, time out, right?
Now we do a timeout.
Come over here.
Sorry.
No, like, do
No,
it
like,
out
She
already.
wants you to do a timeout.
Alright, time out. Alright, we have Dr. Ramirez. Patient's name is Minnie Van Ryder. Date of birth, do I have to give the date of birth?
Mm-hmm.
1/10/98. She's 21 years old. And the surgical procedure is open
Cholecystectomy. Cystectomy.
The site verification is the abdomen. Allergies, none. Antibiotic given and Ansef,
Mhm.
2 grams. And the time was 1:30 p.m. Everybody's in agreement?
Yes.
Yes. Okay.
Okay, and now you would pass the scalpel to the doctor. Okay, all right, done. Doing same thing with pouring the irrigation. I know you all learned how to do it, so today you're actually gonna be doing it. The either second scrub tech or the circulator will do it. Okay, so just a couple of things that are gonna be a little bit different than from the other rooms that I'm gonna be introducing. Same thing with anesthesia concepts and circulator team. So anesthesia and circulator work together. Second scrub tech and scrub tech work together. Surgeon stands back. Who's my surgeon?
Surgeon.
Carmen, so Carmen, you're just basically standing back until we're ready to scrub.
Okay.
Okay, so start time is when you open that pack, okay, is when we start the start time. Margarita, you're gonna put her start time. We ready? Yes?
Yes.
Okay, so our start time is 36. At this point, circulator and anesthesia, we're 30 at the patient.
2:36.
2:36.
So circulator and anesthesia, let's pretend you went to go get your patient.
Go this way?
Yeah, and come in as if you wheeled your patient in together.
Bring out.
You guys start. Oh, yeah. Okay. We all wheel the patient in. Anesthesia comes to the head of the table.
Okay, anesthesia. So then,
Bring your patient over.
okay. Pulling up the
Patient, you come over your head. Okay, so there you have this way. Make sure all your stuff's in order. Okay. So now, what's your patient's name?
Ben
Minnie.
Van Ryder?
Van Ryder.
Yeah.
Van Ryder. These are fancy names. Oh, okay, so you're good. You can see here, Mr. Van Ryder. You're gonna talk to your patient. Mr. Van Ryder, I'm gonna be putting the safety belt, so go through the process, EKG leads, blood pressure, cough, all that good stuff.
Okay, so,
Hi, Mr.
You ready?
Or Mrs. Van Ryder, I'm just gonna be going here and putting on the, what is that? Don't.
Safety belt, so
The
just
strap,
walk the
safety
distance.
strap
Remember, you have to
onto
be
your
less
thighs.
than, more than a foot away, okay? Make sure you give
No,
yourself
that
that
was on
distance.
top.
Now,
Oh,
Margarita,
okay.
remember
That
when the
goes
nails
another
done
way.
like that?
Hey,
You're not always gonna
it's
have that option to do that. I wouldn't suggest you get comfortable with that, okay? So putting your mayo stand here, it's okay sliding it over, but completely pulling it out like that isn't gonna work, okay? So that means that you can slide it over, giving yourself this much distance. Okay? I wouldn't completely obstruct the working area, okay? Right there. Okay, I don't know, keep on going. Yes, absolutely. So you start talking to your patients. I'm gonna be putting some cold sticky patches on you, Mr. Van Ryder.
Mr. Ben Ryder, I'm gonna be putting some patches on you, they might be cold.
You can help her. You should be wearing gloves, both of you should be wearing gloves. Remember, anytime you have patient contact.
Oh, yeah.
I need to open my nose.
Keep on going, Margarita.
No, I'm like totally in the way. I'm not here.
Get it only from the edges, stop it. You get it corner to corner. Yeah. With 2 hands, Margarita.
Can I get another one?
So you get another pair of gloves.
How would I put this one through the smoke or?
Yeah, you have to get it. Now remove here. Arm up. There.
If I can't, open it
You can. So, what you do is come this way first, okay? And then you dip this. Okay, sometimes by doing this one, it opens both of them.
Right.
Okay? And it's easy, right? And now, if I see that over there, then I can come. And then I can just simply grab it from here.
You're gonna be cold, okay? It's
And use
okay.
this kind of back wall.
Can I,
Yes, and then you face it. Okay, alright, let's start over.
Okay, Mr.
No, keep on Mr. Ramirez.
Van Ryder.
She's gonna put the handcuff on you.
Okay, I wanna make sure, Vivian, when you're walking out here, that you're facing this field, okay? So you don't like just walk carelessly through here without
So the
looking.
circulator is the one that puts
Yes.
like.
Circulator and anesthesia.
I didn't put it on her. Yeah, she's gonna move her secretary, because otherwise I can tell her.
And I can move around and like tuck his arms.
Not yet.
Where does this,
Wait, I
We're gonna
open
go
it
ahead
to
and
mine or her?
But all of these, what are these things called? Are these invasive or non-invasive devices? These are non-invasive monitoring devices, so we gotta get the EKGs going, the blood pressure, the pulse oximetry.
Doesn't matter, because I'm gonna
Okay,
get
before
it.
we proceed. Once we have all that going, now anesthesia gets started. Okay, so
What's the
anesthesia,
pulse? It's gonna.
you don't have it.
The trash.
Okay, so now we're gonna tell your patient that we're gonna start, putting the patient to sleep, so we're gonna start putting you to sleep.
Okay, Mr. Mini Rider, we're gonna put you to sleep now, okay?
So we're gonna give them some oxygen, okay? So sometimes they'll ask you to go ahead and hold the mask. Okay,
Hold the mask, please.
Okay, and they start getting your endoscope. And these items, this and this together, airway and the tube. Bring it over. Just keep on holding on to it. You're gonna start feeling sleepy. Start your
You're gonna start feeling sleepy and drowsy.
Okay, now eventually the patient falls asleep at this point in time, okay, you let go. She'll take on anesthesia, will hold it now. Okay, so anesthesia, now you're getting ready to intubate. Okay, so you're gonna go ahead and pull that over the machine. Okay, so now you're gonna go ahead and put this into the mouth. So he puts it in the mouth, and they'll go ahead and oxygenate. This is an oral airway, this is just to open up the airway versus the mannequin. And it would open the airway so they can put oxygen into the lungs, right, so we can start getting ready for the intubation process. Once we do that, go ahead and put that back, and take this out. Take this out. And now you get ready to intubate. So you'll see them go like this. You'll go to that hole right there, that's the airway. And you're gonna put this tube in. Well, you're not gonna put that all the way into it. Oh, that's where your tube goes. Okay, and you choked it. Come on. You just wanna expose that hole. Okay, and you get your tube. Okay. And you get into that hole. This is all part of the nurse, CRNA's role or anesthesia, right? That they go ahead and ask you to pull the stylet circulator.
Circulator, can you please pull it?
Okay, take out the laryngoscope, leave the tube in, and with the other hand, inflate it. That's gonna go ahead and create a cuff in the trachea. And secure the tube. See that? Disconnect it. Okay, now disconnect the mask from over here.
Excellent.
Get the info, that's gonna be given back to her in a minute. Get the tube. And connect it. Now we're putting oxygen and gas into the patient. This is going to keep the patient asleep.
So can we secure it there like
You
with
would
tape
secure
or
it with
something?
tape around here, yes. You take that back, you get your stylet, and now anesthesia is done. Okay, so now you gotta take over. Now you can expose your patient. You expose to mid-thigh. Touch the patient's arms.
now the tucking of the arm.
Can you help me with the magnetic pad? Oh, wait, no, because I need two.
It's okay, you can grab it.
I think I
Yeah, you can grab it. You're sterile now. And start it. You can put it over there with your basin. Now you can proceed.
Circulator, what do I do with it?
The excess, gown, I just try to
Yeah,
roll
just
it.
tuck it in.
Yeah.
Sit, watch how, you gotta give a distance, so.
I'm sorry, right
That's
behind.
good.
And then, can I turn this way or no?
Yes.
Yes, cause I'm already over
Because
here.
you're already more than a foot. Now come to your back table.
No, let's put it up here.
So Margarita, make sure they're not sliding off. They got flip into. Here's your meal, Margarita. That's what you should be gathering first, Yahida. Get your nail stand covered.
Oh, okay. These ones are contaminated,
That's right, take them
Yeah.
off. Grounding pad on.
This will be after?
Yeah.
They're putting
Once the patient is asleep.
And who was for the IV?
That's already started in the holding area.
Okay.
Tell her to take it if you're unsure, by the way, that she can just easily grab it from you. Okay, so once all that's done, you can go ahead and turn on your light. Yes, ma'am. Okay, close the gap. Close the gap to the table. You can grab a hold of it, Jahida. You can actually hold the nail stand from the sides.
Can I move this one as well?
You need to grab a towel and first nestle your basin. So grab a towel. Take it to that basin and let it hang lengthwise to drape it out first.
And I can, while I'm at it, I can move this cart out of the way.
Yeah. That's not sterile and you're not sterile, so you can move it out.
Here, right? Or do I do it the back of it?
No, that's yours. Just get those gloves out of your way with your other hand. Okay, now nestle the basin.
Not give it, right?
Nestle, no. Nestle the basin.
Oh, over here.
Yeah, let it drop. Watch all that, make sure it doesn't drop. Let's slide it over from the top, inside the basin, Now come to your back table and start laying out your towels. Those towels all have to be facing the back wall, the open ends of the towel, facing the back wall.
Oh, the opens.
All of them like this.
Yeah, and those utility sheets should be over there with your drapes, not with, under the towels. So put it in the basin for now.
Over
Okay.
here, over here.
It doesn't matter, you're gonna move them in a minute. So now put your 3 towels, one on the left-hand side of that back table, one on the nail stand, and one on the back of the basin. You get ready to prep your patient. So what you would do now is go ahead and get your clippers, and you would take any excess hair. She's a female, right? So hopefully she's not hairy, we don't need to do any clipping, so we're good. So we're gonna go ahead and proceed with the prep. So you're gonna go ahead and get your prep tray ready, and you're gonna get your, trash over, so you can ask Carmen to slide your trash over here.
Jahira, can
So
you
let's
put
say
my
the
gown?
patient's very hairy, like a man.
My gown is in there, so.
Right here, do we need to shave him?
Yes, if it's in the area where the
My
incision's
gloves are
gonna be,
7.
yes,
Okay.
because you don't want that hair in the
Right.
incisions.
Okay,
Okay, so this isn't, like it would be an open sterilely, that prep tray.
I can move it for you.
Okay.
I'll get it. So then I go and I can scrub,
Not yet,
not yet.
she still needs to do things possibly,
Okay.
okay? Now you're gonna go ahead and take those gloves off.
Can I put one over there?
You will put that one, yep. This is where the patient again is being prepared by the nurse.
Can I open it here?
instead of here?
Yeah, that's fine.
Alright, so now then.
So now you're gonna go ahead and get those top gloves, just from the very top, pinch it, and take them off the field, and take them off, and open glove technique off of there or off of here. Open glove technique, I believe you were taught how to do that. So make sure you're just, when you open that it doesn't dry, and you gotta put it over there. So I would've like removed those gowns so they're really in my way beforehand.
So where did you do that?
Just there where the basin is. Right here. So you wanna get a hold when you're moving towels, okay, just get in the process of getting it all together. Don't let it like go dry just all over the place. So get it all together and then drop it when you're ready to place it.
How to drop it?
Again there, so you're a little shorter, so you have to be careful and look at how this is in your way, so come off to the side. So that way you're not doing that and just, there you go, just let it drop. There you go, simple.
Okay, I can move this now,
Come
right?
over here, no, not yet, come over here and I'll start sorting this out. Once you open glove, you're gonna get that, just leave it up there. Get those white paper. So don't undo it from there yet, cause you haven't counted them yet, so you can't undo it yet. You're gonna cup. Okay. You're gonna
Which
pick it
way?
up. It doesn't matter.
This way.
Oh, the shiny spine. So you're gonna get it and you're just gonna do this and put it
This way.
onto the patient.
Oh, there's no longer.
Yeah, they're the same size.
Okay.
And you're gonna tuck it right here,
I'm gonna place it where?
right alongside, right there, just so that we can collect some of that drip from the prep.
Oh.
But don't let your gloves touch the gown, okay? So you wanna try to tuck that in carefully.
So then, right there.
So remember, you're prepping the patient all the way alongside, so you have to, yeah, so when you do that, protect yourself, you come here.
Over there.
Over there?
Right, the blue. So I'm gonna move over there.
Yes,
Right,
yes, exactly.
Okay.
Okay, and then from this.
Uh-huh.
Or
Now
can
that
I,
will
or
go
do I
on the
start,
opposite side.
or do I first here first and then?
No, you're gonna take that back there anyways here, okay, so put this over here. Okay.
Alright, I'm passing right behind you.
Get it in the corner. Okay, now put this all together, no marking pins in there, by the way, in your ruler.
Oh.
Put it there. Okay, now get that drape sheet, put it in there.
Oh, and I'm gonna put it over
Right
here.
here. Now you put that here, now put those gowns on top of there. Now, once you've done that, Eileen, come back around
Passing right behind you again.
and start sorting out, put the knife pad over here. Put all your towels all together. Okay, so now, over here. Put those right here. Just don't touch any of the metal, remember your sterility. Sometimes you have to slide it over, take those bottles out. Both of them? Put them right there. Okay, take them out of the tray. Get those sponges. Not those, these sponges.
Oh. Okay.
Okay, there's two bottles there, one says scrub and one says just plain iodine. The detergent, which you're gonna scrub, goes in here, okay, and then the paint goes onto these sticks. Okay, so you pour. And then this, right? Okay, so then you're gonna go ahead and get the one sponge, and you're just gonna kind of pour some solution right over the belly. Kind of, and take it back. And then get the cotton tip applicator. Right there. And clean the umbilicus. Okay, so now you did that.
And then.
Discard, that's why I put the transfer lever for you, so you can discard. Okay. And now get your first, nope, your detergent.
Oh, detergent first, okay.
Detergent, and you're gonna start from the incision site, right here, scrubbing, all the way out to the periphery, all the way to this, and toss, and then do it again.
So then around the belly button or no?
Yes. Well, you're gonna start here, and then around. You already scrubbed it with the,
And then I'm gonna go around. And then just across the legs?
so, this one. Hold on, Eileen.
Okay.
So, where's your crease? It's in half, okay? Like this, in half. So just keep on going, so again, it's at the incision site,
Okay, I
and
did
then
that.
around the periphery, all the way,
It's gonna be.
all the way, all the way,
Now-
all the way.
I need to get my
Here,
circle up
and then here, discard.
Yes.
And then do it again. Okay?
And then do it with the other sponge, right?
Yep, with a clean sponge, and do it again, starting at the incision,
Uh-huh.
all the periphery, all the way around. Do it over there. All the way around. There you go, there you go, just like that.
Okay.
Naturals. Okay? Now, once you've done all that,
Scrub it.
now you're gonna dry it off. So now you get that, open it up, watch not to drag. See, this is why I'm having y'all do all this, because sterility, again, you still don't have in your head that I've got sterile gloves, this is a sterile tray, I cannot put that in contact with something non-sterile. And that's the hardest part of learning this entire job that we do, how to maintain sterility, right? Isn't that what you're having a real hard time with?
And then also the same thing, cupping it.
Cup. Okay, now put it over belly. Just drop it, and you'll kind of do this motion,
Just pat it.
that's it. And then from the very top, with two hands, open up, with two hands, okay, just pat it up. With two, across. And then okay.
That's how you
Across.
dry it?
Yes.
Oh,
Jump
you
like
mean-
this, and then you just sit here and bring it back this way.
Oh, you're not gonna scrub that, touch the
No,
picture.
okay, bring it back. And now, once we've dried it, now we're gonna go ahead and paint with these brushes, right? So you would throw this away.
Do I tell her to open this
Yeah,
up?
she should have opened that
Oh,
for you.
can you open it, please?
And I'm gonna start from here. Same thing. Sure. This is more of a pleat, so this is more like, you can do that all the way.
Thank you.
Can I rub it this side? Just so that you don't go back to the spot that we have previously done.
Who is the circulator?
Yep,
The circulator does all that?
yes,
Okay. Oh, wow.
yep.
You trash it.
Do it again.
Until it's all three of them.
Until it's all done. Yep. Yeah, this is what the circulator is doing the entire time we're setting up. Okay? All this.
Okay.
Yeah, you're the second scrub tech, so you're kind of watching her and see if she needs anything. Sometimes, like, she'll say, you know what, Margarita, Dr. Gonzalez likes that long Kittner, it's in Peel Pack, can you go upstairs and go get it? This is your time to go and get it for her,
Okay.
okay? So that's if you have the luxury of having a second scrub tech in your room. If you don't have a second scrub tech, then the one that have to go get it is whom? But your circulator right now is busy.
Me, right?
No, your
Circulator,
scrub.
because you already scrubbed.
Right.
Oh, okay, never mind.
That's who would go run and get it. When you have a second scrub tech, it's a lot easier than when you're working alone.
But that doesn't always happen.
Exactly. Sometimes it's just you and a circulator and an
Can I
anesthesia.
turn my gatito here?
Yes.
While I'm
Alright. Same thing, huh?
That's it. So now your patient's prepped and ready to go. So you discard the rest.
What a way. So the rest,
Oh, you
the rest
gotta
of the sponges is,
Done.
okay.
Well, she would have used them all.
Oh, okay, okay.
But we only did the three that were here.
Yeah, you would have used them all.
No,
Yeah.
all of them?
Yes.
For the
So
scrub?
all the
Yes.
sponges and then
Yeah.
that.
Yes.
Okay.
So now you take up this paper.
Just super
Carefully. Yeah.
Inside?
Pull it. Put it over there. And come pull this one.
And the pads right behind you?
And now the patient's prepped and ready to go. So now you would clear this out of the way because I don't want this to be in my way when my surgeon comes in or anything, right? Okay, you could take that out of the way.
Excuse me, I'm gonna pass my paper. So then this,
We'll put that back up and then put it over there in the corner and get that prep table out of the way.
So that's all trash.
That's all trash. Exactly. Okay, one use. That's it. So Margarita, if you wanted to, while she's setting up here, one more thing you could do is, while she's setting up, you can come show her the sodium chloride and the expiration date and pour it. This would be a good time to do it. She's watching real quick.
wait, I can pour it?
Yeah, you're not sterile. And you're the second scrub tech. So this is something you can do.
But I thought I wasn't allowed here to sterile field.
You can touch the sterile field, but you can remain away from the sterile field, right?
Okay.
So you can go up to her, right over here, and show her. Sodium chloride.
Sodium chloride, expiration date 10/3,
2020.
10/20/20.
Okay, so
I'm like
unscrew it.
2014, nah.
Nah. and then you pour it. Now you can tell her you wanna get your septo out of the way,
Do you wanna get your septo out of the way so I can pour the sodium
put in your
chloride?
emesis.
Do I take off the little thing?
It's a- There's something in the indicators, is fine.
Oh.
You
Okay.
would, but you wouldn't have those in the real world.
Oh,
Put
okay.
the septo,
Put
the
away.
emesis base here.
Oh.
Yep. and
I
pour
can
it.
continue, right?
Yeah, you continue doing your thing. Yeah, fine. Just pour it, Margarita. Pour it all of it. And once you finish pouring it, that's it. Come back and that's it, step away. That's it. Done. So you were, at least you were a foot away, and that's okay. I mean, obviously you're gonna have to go over the basin, so there's no other way to do it. What is recommended is for the tech to get that basin and bring it over like this, so you're not close to that field. If not, if they're busy, you just ask them to put it to the very corner of the table.
So I can
pour it.
pour it. Okay.
Alright, so she's still setting up. This point in time, you've already given her irrigation. You can ask her, is there anything else I can get you?
Jahida, is there anything else I can get you?
And then at this point, say, okay, I'm gonna go to the restroom. This is say you have to. I'm gonna go to the restroom and then I'm gonna go scrub. Okay.
Alright, so Jahida, I'm gonna go to the restroom and I'll be back to scrub.
Okay. That's it. You don't have to go to the restroom or anything. Yeah, some of the techs will sit down and just wait because there's no point, she still needs to count. So I don't wanna scrub just to stand there, you know, so I
So I
just,
don't put on my gown yet?
not yet, she's gonna give you the down gloves here in a minute. They already were flipped, right?
Yes,
And the surgeons, right?
yes.
So then you're good, your part is done. She says she doesn't need you to get anything for her anymore, she's got her irrigation. This is a time where you would get irrigation, medications, like if she needed locals, you would get her locals. Or again, if she needed something from upstairs, go get it for her. That's what you would be doing.
Can I take off these ones, right? 'Cause, I mean, it's part of the procedure.
I had her put my gown on top of yours.
They go into the kit, yeah. Fine.
I feel like it's a lot of stuff.
It is.
I don't think I'll be ready.
Everyone.
It feels like once it's.
It should feel that way. That's because all his knowledge is going in there. That's why. But there's space in there, right?
I felt okay when I like over there, like, but then all these other steps, I'm like, oh no, this is all this other stuff else have to be.
But the more we do it, I think the more confident we get.
Exactly.
But what I feel like the issue is there's not enough time to practice. It's not hard, it's just there's not enough, the overload of,
I understand now when you know.
it just keeps going and there's not enough time to catch up to practice. It's like you show one time and then I feel like we're expected to pick up and then move on to the next. And I feel like we need more practice than just one time.
Yeah, I agree.
Can I put it back?
Yeah, not yet. You don't need to load it. Okay, now.
I think I'm ready.
Alright.
I'm ready to count.
Yeah, it is very fast paced. I mean, I never said it wasn't gonna be, you know, it's a very
Yeah, Mike, are you
fast-paced
ready?
program.
Yes.
And it is going to go after another. Laparotomy, you have, what, 3 weeks to master, you know, and it's a lot. It's a lot to learn within the laparotomy setup. You have to combine skills.
Was it like 15, 20 minutes? Miss San Pedro? Was it like 15, 20 minutes you have to do it in?
Setup, we say 14 minutes,
Yeah.
but realistically, most students do it within 20.
Okay.
So go.
She's not ready yet.
Oh, she's not ready.
I'm ready.
You ready now?
Yeah, I'm just fixing this.
Okay.
So go stand over there, Aideen. Aideen.
Like this or
Aideen?
like this?
Aideen. Like,
Okay.
Like that, okay.
Bow 4 frame.
One.
Okay. Small fenestrated blade or fenestrated blades.
Okay. 1 too small, 1 too large.
Okay. Deep bladder blade.
Like nothing next semester.
The bladder blade.
Oh, 1.
It's
Sorry.
something you don't even realize you're
Army Navy
advancing in,
retractors.
but you are.
1 2.
Richardson's.
1 2. 1 too small, 1 too big. Large.
Okay.
Sorry.
Deaver.
We as
One.
instructors see it, and we know you are.
Gilpy.
It's just, it's a
One.
process, but you guys, because
The
you have
River
the
Ma-
frustration of
Malibu.
learning it and
One,
being
two.
challenged by meeting expectations, our
Harrington.
expectations is where
One.
your anxiety comes from. You have
Like
less
scissors.
but we see
okay,
it,
I
and it's
have
like, okay,
one,
this
two-
is a
one,
normal
two,
process.
three,
All these
four.
Questions
Okay.
and fears, and I'm like, oh my God, I'm not getting it, you're getting it.
Forceps.
Everybody's been complaining. 1 2 3 4 5 6.
That's expected, but you're getting it, and we
All
see
right, we're gonna
it.
start with the
We all
class.
need to, like, just be
Okay.
patient with yourself, like,
Mosquitoes.
1
you overwhelm yourself, you
Two.
overwhelm yourself.
3
You know?
4.
Okay. Straight cryos.
1 2.
Curved cryos.
1
That's great. That's great. You'll be flying.
1 2 3 4 5 6 7.
Curved cryos.
I think I confused. Okay. 1 2 3 4 4 5 6 7. We got stuff. 7 8.
8. Okay.
Yeah.
Mixer right angle.
1. So
P-
to hide it, let me show you.
peons.
So what you wanna do,
I don't know.
yeah, I know, because it's hard to control at first, okay? But hold on to this.
Oh, I can.
Oh, yeah, you can hold on to it. So once you finish it, like 1, 2, 3, 4, 5, 6, okay?
Oh, okay.
And then move on to the next one.
Okay.
1, 2, 3, 4, okay? Yeah, you can secure it.
Okay.
So we stayed on the
Peon.
peons.
1 2.
Just don't push all your tools off the wall. But you will do that too, so you just have to learn to control it. So you put your instruments more to the center
Oh, okay.
of that roll. That may not happen.
Oh, so, okay. Recount 1 2 3 4 5 6.
Okay.
Now
Alice.
let go of this because you don't need to hold on to this anymore. Go on to the next bit of instruments. This roll of yours is broken. See, that's another problem that you have because this roll has to be tubular. It's flat, so that's not gonna stay. It's gotta be more
Alice?
tight.
Alice. Yeah.
1 2 3 4.
Babcocks.
1 2 3 4.
What is it? Kosher.
Coker.
Coker Oshner.
1 2 curved ones and 1 2 straights.
And the Serret.
Sarah.
1
Sarot.
1.
Okay.